Dr. Lado Ismail. I'm a fistula surgeon. I was born in Khartoum, in Sudan. I schooled there, primary school, secondary school, and medical school also. Then after that, I shifted to southern Sudan. I worked there, then I shifted to Uganda, northern part of Uganda. I worked there. That's actually when I started having that sense of, see women suffering there. Medical profession, usually we say it is a calling. It is not a profession, it's a calling. So me, I think I had the calling long ago. Since I was young, usually I used to believe like I had that passion of helping, becoming a doctor. Then I struggled, I worked for it, I became a medical doctor. Yet in the medical fraternity still there are some subspecialties, and some of them are really needy. They are not that rewarding, but financially, but they are rewarding in terms of some other moral parts. So I looked at women in general in some parts of the world, Africa in particular, the women who are suffering from a lot of issues, reproductive health services. So I joined obstetric and gynecology training. I became an OBGYN. And after that, deep into the OBGYN still, I looked at some specific areas where women are really suffering and they need help, and not very many of our colleagues are willing to help them. So I decided also to join fistula training, and with the help of the county government of Garissa where I worked, and our partners, AMREF, the Global One, and some other partners, Fistula Foundation and FIGO. Fistula surgeries or fistulas in general, they are a very unique condition that happens, and usually it has a lot of social, economical encounter that these ladies usually go through. Usually it affects ladies who are young, very young, most probably teenagers who are trying to give birth, but because of lack of proper maternal services, they end up laboring for long until they end up injuring the bladder, and they end up having fistulas. The approach to fistula, it is usually a complete approach, because there's the fistula itself, the management of the fistula itself, then the management after the fistula. My appeal is for the government and all the partners, the health partners and your partners, is to improve the quality of the maternal services first, just to avoid complications, because rather than treating the fistulas, we can avoid them, we can prevent them. Fistulas are preventable and treatable. So if we improve maternal health services, as we are doing now through the universal health coverage, this will reduce dramatically the numbers of fistula cases. And we appeal to the partners of Ministry of Health to also aid into training more fistula surgeons, because still we are lacking fistula surgeons in the country. The numbers are not that good as for now, so we appeal to the partners also to at least to boost the numbers, so that at least we'll have a plan to end fistula actually by the year 2030. Fistula is curable, it is treatable, it is not a curse. Yeah. It is curable, it is treatable.